Hello, I am Mark Johnson, your educator here at YNS. Today's session covers a new set of NCLEX practice questions using our partner platform, Exam ASAP. Exam ASAP is an AI-powered question bank that adapts to your performance and provides audio rationales for efficient review, unlike anything you have seen before. For full access, see the description box below. Have your notebook ready and follow along as we strengthen your critical thinking skills. Without further ado, let's begin with question 1.
A 68-year-old client with a history of mitral stenosis is admitted to the hospital with worsening dyspnea and fatigue. The client is on a low-sodium diet and takes furosemide daily. Current vital signs are BP 110/70 mm per minute, HR 88 BPM, RR 24 breaths per minute, SpO2 92% on room air. Which nursing intervention should be prioritized to address the client's current condition? Administer supplemental oxygen via nasal cannula. Increase the client's furosemide dose. Encourage the client to ambulate in the hallway. Provide a high-sodium snack to increase energy. The correct answer is A. Rationale. Correct answer, A. Administering supplemental oxygen via nasal cannula is the correct intervention to prioritize for this client. The client is experiencing dyspnea and has an SpO2 of 92%, indicating mild hypoxemia. Providing oxygen can help improve oxygen saturation and alleviate respiratory distress. This intervention directly addresses the client's immediate need for improved oxygenation, which is critical in the context of mitral stenosis, where pulmonary congestion can occur. Monitoring and maintaining adequate oxygen levels is essential to prevent further complications. Distractor rationales. B. Increasing the client's furosemide dose without a provider's order could lead to electrolyte imbalances and is not the immediate priority. C. Encouraging ambulation is not appropriate at this time due to the client's dyspnea and low oxygen saturation. D. Providing a high-sodium snack contradicts the client's dietary restrictions and could exacerbate fluid retention. Clinical tip: in clients with mitral stenosis, monitor for signs of pulmonary congestion and prioritize interventions that improve oxygenation and reduce respiratory distress. A 35-year-old veteran with a history of post-traumatic stress disorder, PTSD, is admitted to the hospital for a scheduled surgery. During the night, the client experiences a flashback and becomes increasingly agitated. Which nursing intervention should be prioritized to ensure the client's safety and promote physiological integrity? Here are the options. Option 1. A. Administer a prescribed sedative immediately. Option 2. B. Restrain the client to prevent self-harm. Option 3. C. Speak calmly and provide reassurance to the client. Option 4. D. Call the healthcare provider for additional orders. The correct answer is C. Rationale. Correct answer C. Speaking calmly and providing reassurance is the correct intervention, as it helps de-escalate the situation without compromising the client's autonomy or safety. This approach aligns with maintaining physiological integrity by reducing stress and preventing potential harm. It also respects the client's dignity and promotes a therapeutic environment. This intervention is crucial in managing PTSD-related episodes, as it addresses the immediate emotional needs of the client. Distractor rationales. A. Administering a sedative without first attempting non-pharmacological interventions may not be appropriate and could mask symptoms without addressing the underlying issue. B. Restraining the client can increase agitation and trauma and should only be used as a last resort when the client poses an immediate threat to themselves or others. D. While consulting with the healthcare provider is important, immediate de-escalation techniques should be prioritized to ensure the client's safety. Clinical tip: in situations involving PTSD, always prioritize non-pharmacological interventions first, such as therapeutic communication, to help de-escalate the situation and maintain a safe environment. A 10-year-old child with newly diagnosed acute lymphoblastic leukemia, all is beginning chemotherapy. The parents express concern about their child's growth and development during treatment. Which nursing intervention is most appropriate to promote the child's growth and development during this time? Here are the options. Option 1. Encourage participation in age-appropriate physical activities as tolerated. Option 2. Limit social interactions to prevent infection. Option 3. Focus solely on academic activities to maintain cognitive development. Option 4. Provide a high-calorie diet to prevent weight loss. The correct answer is A. Rationale. Correct answer, A. Encouraging participation in age-appropriate physical activities as tolerated is crucial for promoting normal growth and development in children undergoing chemotherapy. Physical activity helps maintain muscle strength, supports cardiovascular health, and provides a sense of normalcy and social interaction, which are vital for psychosocial development. While infection risk is a concern, activities can be modified to ensure safety. This approach balances physical health with developmental needs. Distractor rationales. B. Limiting social interactions excessively can hinder social development and lead to feelings of isolation, which is detrimental to the child's overall well-being. C. Focusing solely on academics neglects other aspects of development, such as physical and social growth, which are equally important. D. While nutrition is important, a high-calorie diet alone does not address the comprehensive developmental needs of the child. Clinical tip: incorporate play and social interaction into the care plan for pediatric patients with chronic illnesses to support holistic development and well-being. An 8-year-old child with Down syndrome is in the emergency department following a fall at home. The nurse must prioritize care. Which action should the nurse take first to ensure the child's safety and effective emergency response? Here are the options. Option 1. Perform a neurological assessment. Option 2. Contact the child's primary care provider. Option 3. Administer pain medication as prescribed. Option 4. Reassure the child and family about the situation. The correct answer is A. Rationale. Correct answer, A. Performing a neurological assessment is the priority to identify any potential head injury or neurological compromise following the fall. Children with Down syndrome may have increased risk for certain complications, making it essential to assess for any changes in mental status or neurological function. This action ensures immediate safety and appropriate emergency response. Distractor rationales. B. Contacting the primary care provider is important, but not the first action in an emergency setting. C. Administering pain medication is secondary to assessing for life-threatening conditions. D. Reassuring the family is supportive, but not the priority in ensuring the child's immediate safety. Clinical tip: in emergency situations, always prioritize assessments that can identify life-threatening conditions or complications. Which infection prevention measure is crucial for a client with Cushing's syndrome? Here are the options. Option 1. Administer prescribed glucose-lowering medications. Option 2. Encourage increased fluid intake for hydration. Option 3. Monitor blood pressure and adjust medications. Option 4. Implement strict hand hygiene and contact precautions. The correct answer is 4. Rationale. Correct answer, 4. Clients with Cushing's syndrome have impaired immune function due to prolonged corticosteroid exposure, making them highly susceptible to infections. Strict hand hygiene and contact precautions are essential to minimize the risk of introducing pathogens. Ensuring a sterile environment greatly reduces the chance of nosocomial infections in these immunocompromised clients. Distractor rationales. 1. 1. Medication management is important for controlling symptoms, but does not directly prevent infection. 2. Increased fluid intake may help manage symptoms, but does not address infection risk. 3. Managing blood pressure is important for overall health, but is unrelated to immediate infection prevention. Clinical tip: in immunocompromised clients, such as those with Cushing's syndrome, emphasize the importance of maintaining skin integrity and practicing routine hand washing to reduce infection risk. A 2-year-old child is brought to the emergency department with croup, presenting with a barking cough and stridor. The parents are visibly distressed and anxious about their child's condition. The healthcare provider has ordered a dose of nebulized epinephrine. What is the nurse's priority psychosocial intervention for the parents? Here are the options. Option 1. Explain the mechanism of action of nebulized epinephrine. Option 2. Reassure the parents that the treatment is effective and their child is in good hands. Option 3. Instruct the parents to remain calm to avoid distressing the child further. Option 4. Provide detailed information about the signs and symptoms of croup. The correct answer is B. Rationale. Correct answer, B. Reassuring the parents that the treatment is effective and their child is in good hands is the priority psychosocial intervention. This approach helps alleviate parental anxiety and fosters trust in the healthcare team. While education and instructions are important, addressing the parents' immediate emotional distress is crucial in a crisis situation. Distractor rationales. A. Explaining the mechanism of action may not alleviate immediate anxiety. C. Instructing parents to remain calm without addressing their concerns may not be effective. D. Providing information about croup is important, but secondary to addressing immediate emotional needs. Clinical tip: in emergency situations, providing reassurance and emotional support to family members is as important as the medical care provided to the patient. A worried parent rushes their toddler into the clinic after noticing signs of regression in toileting and speech. Upon assessment, the nurse learns the family has recently moved to a new city. What should the nurse discuss with the parents? Here are the options. Option 1. A. Reevaluate developmental milestones. Option 2. B. Offer reassurance and discuss stress-related regression. Option 3. Recommend immediate evaluation by a speech therapist. Option 4. D. Suggest the introduction of a strict routine. The correct answer is B. Rationale. Correct answer, B. Offer reassurance and discuss stress-related regression. Regression can occur with significant changes like moving, and usually, reassurance and time help the child adjust. Distractor rationales. A. While reevaluation can be helpful, reassurance about regression due to stress should be the first step. C. Immediate speech therapy may not be necessary unless regression persists despite initial interventions. D. A routine is helpful but should be flexible and adapted gradually. Clinical tip: regression in children can often be temporary and related to stress. Provide support and monitor progress. Memory aid, REST, regression, environment change, stress response, time and support. A 30-year-old lactating mother presents to the clinic with a tender erythematous swelling in her left breast, diagnosed as a breast abscess. When discussing growth and development with the client, what advice is most appropriate to support her infant's nutritional needs while managing the abscess? Here are the options. Option 1. Discontinue breastfeeding from both breasts until the abscess resolves. Option 2. Continue breastfeeding from the unaffected breast and pump from the affected breast. Option 3. Stop breastfeeding altogether and switch to formula feeding. Option 4. Continue breastfeeding from both breasts, ensuring proper latch. The correct answer is B. Rationale, correct answer. Continuing to breastfeed from the unaffected breast and pumping from the affected breast is recommended. This helps maintain milk supply and provides the infant with necessary nutrition. Pumping can also aid in managing the abscess by relieving pressure and promoting drainage. This approach supports the infant's growth and development while addressing the mother's health issue. Continuing breastfeeding from the unaffected breast ensures the infant receives the benefits of breast milk, which is critical for appropriate growth and immune support. Distractor rationales. A. Discontinuing breastfeeding from both breasts can lead to engorgement and decreased milk supply, hindering the infant's nutritional intake. C. Switching to formula can deprive the infant of the unique benefits of breast milk, which supports optimal growth and development. D. Breastfeeding from both breasts may worsen the condition of the affected breast and increase pain, which is not advisable. Clinical tip. Educate mothers with breast abscesses that breastfeeding or pumping from the affected site can aid in treatment. A 6-month-old infant diagnosed with failure to thrive is admitted to the pediatric unit. The nurse is preparing to initiate enteral feeding via a nasogastric tube. Which infection control measure is most critical to implement before starting the feeding? Here are the options. Option 1. Ensure the feeding formula is at room temperature. Option 2. Verify the placement of the nasogastric tube. Option 3. Perform hand hygiene before handling the feeding equipment. Option 4. Label the feeding formula with the date and time of preparation. The correct answer is C. Rationale. Correct answer, C. Performing hand hygiene before handling the feeding equipment is the most critical infection control measure to prevent the transmission of pathogens to the infant, who is already vulnerable due to failure to thrive. Hand hygiene is a fundamental practice to reduce the risk of healthcare-associated infections. While verifying tube placement and ensuring correct formula handling are important, they do not directly address infection control. Distractor rationales. A. Ensuring the formula is at room temperature is important for comfort, but does not address infection control. B. Verifying tube placement is crucial for safety, but does not directly prevent infection. D. Labeling the formula is important for safety, but does not directly prevent infection. Clinical tip. Hand hygiene is the single most effective way to prevent the spread of infections in healthcare settings. The client shows confusion, lethargy, and decreased reflexes with high magnesium levels. What is the priority nursing action? Here are the options. Option 1. Prepare for immediate dialysis. Option 2. Administer prescribed antiemetic. Option 3. Closely monitor respiratory status. Option 4. Encourage increased fluid intake. The correct answer is 3. Rationale. Correct answer 3. Monitoring the client's respiratory status is crucial due to the potential for respiratory depression associated with hypermagnesium. Elevated magnesium levels can impair neuromuscular function, affecting breathing. Close respiratory monitoring allows early detection and intervention for respiratory compromise, thus preventing severe complications. This action aligns with the priority of maintaining airway and breathing. Distractor rationales. 1. Dialysis may be needed, but immediate nursing actions focus on monitoring vital functions. 2. Administering an antiemetic does not address the life-threatening complications of hypermagnesium. 4. Fluid promotion can help lower magnesium, but it is not the immediate priority. Clinical tip. In cases of electrolyte imbalances, always prioritize actions that ensure airway protection and effective breathing. A 45-year-old male client with a herniated disc has been experiencing chronic pain for the past 6 months. He reports feeling increasingly anxious and frustrated due to his limited mobility and inability to participate in his usual activities, such as playing sports and working in his garden. During a follow-up visit, he expresses feelings of hopelessness and mentions that he has been withdrawing from social interactions with friends and family. Which nursing intervention is most appropriate to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to join a chronic pain support group. Option 2. Suggest the client increase physical activity to improve mood. Option 3. Advise the client to focus on work-related tasks to distract from pain. Option 4. Recommend the client to explore new hobbies that require minimal physical exertion. The correct answer is A. Rationale. Correct answer A. Encouraging the client to join a chronic pain support group is the most appropriate intervention to address his psychosocial needs. Support groups provide a platform for individuals to share experiences, gain emotional support, and learn coping strategies from others facing similar challenges. This can help reduce feelings of isolation and hopelessness and promote a sense of community and understanding. Additionally, support groups can empower clients by providing them with information and resources to manage their condition more effectively. Distractor rationales. B. While physical activity can improve mood, suggesting increased activity without considering the client's physical limitations may exacerbate his condition and increase frustration. C. Focusing on work-related tasks may not address the client's emotional needs and could lead to further stress if he is unable to perform these tasks due to pain. D. Exploring new hobbies is beneficial, but it may not provide the immediate emotional support and understanding that a support group can offer. Clinical tip: encourage clients with chronic conditions to engage in support groups as they can provide valuable emotional support and practical coping strategies. A 35-year-old client with a history of dissociative identity disorder is admitted to the psychiatric unit. The client presents with multiple personalities and reports frequent episodes of amnesia. The nurse is planning care for this client. Which nursing intervention should be prioritized to ensure the client's physiological integrity? Here are the options. Option 1. A. Encourage the client to express feelings through journaling. Option 2. B. Establish a consistent daily routine for the client. Option 3. C. Provide a low-stimulation environment to prevent sensory overload. Option 4. D. Administer prescribed anxiolytics to manage anxiety. The correct answer is B. Rationale. Correct answer B. Establishing a consistent daily routine is crucial for clients with dissociative identity disorder, as it helps provide a sense of stability and predictability, which can reduce anxiety and confusion. This intervention supports the client's physiological integrity by minimizing stress and promoting a structured environment that can help manage dissociative episodes. Consistency in care can also aid in the integration of different identities by providing a reliable framework for the client. Distractor rationales. A. While journaling can be therapeutic, it does not directly address the physiological integrity or safety needs of the client. C. A low-stimulation environment may help with anxiety, but does not specifically address the need for routine and structure. D. Administering anxiolytics can manage anxiety, but does not provide the structural support needed for physiological integrity. Clinical tip: for clients with dissociative disorders, maintaining a consistent routine can help reduce confusion and anxiety, supporting both psychological and physiological well-being. The assigned patient with Cushing's syndrome 2 days post-adrenalectomy presents with hypertension, peripheral edema, and low serum potassium. To manage this condition, the nurse should administer placeholder 1 and monitor placeholder 2 every 4 hours. The correct answer is placeholder 1, spironolactone 25 mg PO, placeholder 2, urine output. Rationale. Correct answer. 1, 2. Step-by-step clinical reasoning. First, recognize that Cushing syndrome causes mineralocorticoid excess, leading to hypertension and hypokalemia. 2. Next, consider spironolactone's role as an aldosterone antagonist, effectively managing fluid overload and correcting hypokalemia. 3. Monitoring urine output is crucial due to potential polyuria post-mineralocorticoid blockade. 4. Evidence-based practice supports spironolactone for hyperaldosteronism and monitoring fluid status in diuretic therapy. 5. This intervention addresses fluid retention and electrolyte imbalance while preventing progression of hypertension. Endocrine Society Guidelines, 2023. Distractor rationales, clinical tip, clinical pearl. In conditions with mineralocorticoid excess like Cushing syndrome, spironolactone is invaluable for its dual role in reducing blood pressure and correcting hypokalemia. Always monitor fluid and electrolyte status closely, particularly when initiating diuretic therapy. A 45-year-old female client with stage 2 cervical cancer is receiving chemotherapy with cisplatin. She reports experiencing nausea and vomiting, and her laboratory results show a serum creatinine level of 1.8 milligrams per liter. What is the most appropriate nursing intervention to address her current condition? Here are the options. Option 1. Administer ondansetron as prescribed. Option 2. Encourage increased oral fluid intake. Option 3. Hold the next dose of cisplatin. Option 4. Monitor for signs of infection. The correct answer is A. Rationale. Correct answer, A. Administering ondansetron as prescribed is the most appropriate intervention to address the client's nausea and vomiting associated with cisplatin chemotherapy. Ondansetron is an antiemetic that effectively reduces chemotherapy-induced nausea and vomiting, improving the client's comfort and hydration status. While encouraging fluid intake is important, it does not directly address the nausea. Holding the cisplatin dose requires a provider's order and is not the nurse's decision. Monitoring for infection is crucial, but not directly related to the current symptoms. Distractor rationales. B. Encouraging fluid intake is supportive, but does not directly alleviate nausea and vomiting. C. Holding the next dose of cisplatin is not within the nurse's scope without a provider's order. D. Monitoring for infection is important, but not directly related to the client's current symptoms of nausea and vomiting. Clinical tip: when managing chemotherapy-induced nausea, antiemetics should be administered proactively to prevent symptoms and improve the client's quality of life during treatment. A 67-year-old man with a history of hypertension and sedentary lifestyle has recently been admitted to the hospital following a hemorrhagic stroke. During a family meeting, the nurse discusses strategies to support his recovery and prevent further health complications. Which of the following lifestyle modifications should the nurse recommend? Select all that apply. Here are the options. Option 1. Encourage quitting smoking immediately. Option 2. Promote a high-fat, low-carb diet to gain weight. Option 3. Suggest engaging in regular, mild to moderate physical activity. Option 4. Advise limiting alcohol intake to 1 drink per day. Option 5. Recommend a sodium-restricted diet. Rationale. Correct answers: A, C, D, E. A. Quitting smoking reduces the risk of further vascular damage and improves overall cardiovascular health. C. Regular physical activity helps in managing blood pressure and improving cardiovascular fitness, which are crucial after a stroke. D. Limiting alcohol intake prevents exacerbation of hypertension and reduces the risk of additional strokes. E. A sodium-restricted diet is essential in controlling hypertension, a major risk factor for hemorrhagic stroke. Distractor rationales. B. A high-fat, low-carb diet is not recommended as it may increase the risk of cardiovascular disease and is not aligned with stroke prevention strategies. Clinical tip. For stroke prevention, focus on lifestyle changes that manage blood pressure, improve cardiovascular health, and reduce risk factors like smoking and excess alcohol. While reviewing home care notes, a community nurse visits a 78-year-old client who recently lost their spouse. The client expresses feelings of loneliness and hopelessness. How should the nurse respond to support the client's psychosocial needs? Here are the options. Option 1. A. Encourage the client to maintain regular social activities. Option 2. B. Advise the client to consider moving into an assisted living facility. Option 3. C. Assess the client's risk of depression and suicidal ideation. Option 4. D. Suggest the client engage in volunteer work. Option 5. E. Recommend the client join a grief support group. Rationale. Correct answers A, C, E. Encouraging regular social activities helps the client maintain connections and reduce isolation. C. Assessing for depression and suicidal ideation is crucial to ensure the client's safety and mental health needs are addressed. E. Grief support groups provide a community of peers with shared experiences, aiding in emotional processing. Distractor rationales. B. This option may not be appropriate without assessing the client's desire and readiness for such a change. D. While volunteering can be beneficial, it may not address the immediate psychosocial needs or safety concerns. Clinical tip. Grief can mask depression, so thorough assessment of mental health is crucial in bereavement care. Memory aid. GRIEF. Groups, risk assessment, involvement, emotional support, family connection. A 45-year-old client with a history of gastroesophageal reflux disease, GERD, is admitted to the hospital for worsening symptoms. During the assessment, the nurse notes that the client appears anxious and reports difficulty sleeping due to fear of choking at night. The client also mentions feeling isolated because they avoid social gatherings to prevent potential embarrassment from GERD symptoms. Which nursing intervention should the nurse prioritize to address the client's psychosocial needs? Here are the options. Option 1. A. Educate the client on dietary modifications to manage GERD symptoms. Option 2. B. Refer the client to a support group for individuals with chronic illnesses. Option 3. C. Encourage the client to practice relaxation techniques before bedtime. Option 4. D. Schedule a consultation with a dietitian for personalized meal planning. The correct answer is C. Rationale. Correct answer, C. Encouraging the client to practice relaxation techniques before bedtime addresses the client's anxiety and sleep difficulties, which are significant psychosocial concerns. Relaxation techniques can help reduce anxiety, improve sleep quality, and empower the client to manage their stress related to GERD symptoms. This intervention directly targets the client's fear of choking and promotes a sense of control over their condition, enhancing overall well-being. Distractor rationales. A. While dietary modifications are important for managing GERD, they do not directly address the client's psychosocial concerns of anxiety and isolation. B. Although support groups can be beneficial, they may not immediately address the client's current anxiety and sleep issues. D. A dietitian consultation focuses on nutritional management, which is not the primary psychosocial need in this scenario. Clinical tip. Incorporating relaxation techniques such as deep breathing or guided imagery can be effective in managing anxiety and improving sleep, especially in clients with chronic conditions like GERD. A client with PAD reports leg pain. What should the nurse prioritize? Here are the options. Option 1. Encourage walking. Option 2. Elevate legs. Option 3. Apply warm compresses. Option 4. Wear compression stockings. The correct answer is 1. Rationale. Correct answer is 1. Encouraging the client to walk regularly is crucial, as exercise can improve circulation and reduce symptoms of claudication in peripheral arterial disease. Gradually increasing walking distance enhances collateral circulation, which is essential for managing and preventing progression of the disease. This approach focuses on promoting vascular health and functional improvement. Distractor rationales. 2. Elevating the legs can worsen ischemia in peripheral arterial disease and should be avoided. 3. Warm compresses can increase the risk of burns due to decreased sensation and are not recommended. Clinical tip. Walking programs are effective in increasing walking tolerance in peripheral arterial disease. Encourage consistency and gradual increments. An elderly client with pneumonia is admitted to the emergency department with a respiratory rate of 32 breaths per minute, SpO2 of 88% on room air, and confusion. What is the nurse's immediate priority action? Here are the options. Option 1. A. Administer oxygen via nasal cannula. Option 2. B. Obtain a sputum culture for analysis. Option 3. C. Start an IV line for antibiotic administration. Option 4. D. Perform a chest X-ray to assess lung condition. The correct answer is A. Rationale. Correct answer A. Administering oxygen is the immediate priority to address the client's hypoxia, as indicated by low SpO2 and confusion. Oxygen therapy helps improve oxygenation and can prevent further deterioration of respiratory status. Once oxygenation is stabilized, other interventions such as cultures and imaging can be pursued. Distractor rationales. B. A sputum culture is important for diagnosis, but not the immediate priority. C. Antibiotics are crucial, but should follow stabilization of oxygenation. D. A chest X-ray is useful for diagnosis, but not the first priority in an emergency. Clinical tip. In respiratory emergencies, always prioritize interventions that stabilize the airway and improve oxygenation before proceeding with diagnostic or therapeutic measures. A patient with diabetes and hypertension is treated for gastroenteritis and dehydration. Labs show hyponatremia, Na plus 130 milliQ per liter, and hypokalemia, K plus 3.0 MEQ per liter. After receiving mannitol for head trauma, evaluate interventions for their impact on electrolyte imbalance risk. For each intervention, select its impact on electrolyte imbalance risk. Rationale. Correct answers. 1, 0, 1, 0, 1. Step-by-step reasoning. 1. Administering IV potassium chloride 40 milliQs over 4 hours decreases risk, corrects hypokalemia, preventing arrhythmias and muscle weakness. Immediate replacement is crucial to stabilize cardiac function. Electrolyte Management Guidelines, 2023. 2. Continuing mannitol IV therapy increases risk. Mannitol can exacerbate electrolyte imbalances, particularly hyponatremia. Due to osmotic diuresis, increasing neurological risk, Neurosurgical Standards 2023. 3. Administering oral sodium chloride tablets decreases risk, addresses hyponatremia, improving osmotic stability and preventing neurological complications such as seizures. Clinical Nutrition Guidelines 2023. 4. Implementing strict fluid restriction to 1 liter per day increases risk, can worsen dehydration and electrolyte imbalances, increasing the risk of hypovolemia and renal impairment. Hydration Management Protocols 2023. 5. Monitoring serum electrolytes every 6 hours decreases risk, allows timely identification and correction of imbalances, preventing complications like seizures or cardiac arrhythmias. Critical Care Monitoring Standards 2023. Distractor rationales. Number 0. Administering IV potassium chloride is crucial for correcting hypokalemia, which can lead to life-threatening cardiac arrhythmias if not addressed. Delaying replacement would increase risk. Cardiac Care Guidelines 2023. 2. Mannitol exacerbates electrolyte imbalances by inducing osmotic diuresis. In this context, continued use would increase the risk of worsening hyponatremia and potential neurological deterioration. Neurosurgical Standards 2023. 3. Oral sodium chloride effectively addresses hyponatremia, reducing the risk of symptoms like seizures and confusion. In this case, it is a vital intervention to decrease risk. Clinical Nutrition Guidelines 2023. 4. Strict fluid restriction can worsen dehydration and electrolyte imbalances in gastroenteritis, increasing the risk of complications like hypovolemia and shock. Hydration Management Protocols 2023. 5. Frequent electrolyte monitoring facilitates prompt intervention for imbalances, decreasing risk by preventing severe manifestations such as arrhythmias and neurological symptoms. Critical Care Monitoring Standards 2023. Clinical Tip. Clinical Pearl. In patients with polypharmacy and electrolyte disturbances, proactively managing potassium and sodium levels while avoiding osmotic diuretics like mannitol can substantially reduce risk. Frequent monitoring is essential to guide timely interventions, preventing severe complications from electrolyte imbalances. Adjust interventions based on ongoing assessments and evolving patient needs. Advanced Practice Standards 2023. A 45-year-old male client with a history of alcoholic hepatitis is admitted to the hospital for worsening liver function. He expresses feelings of guilt and shame about his drinking habits and is worried about his family's future. The nurse observes that the client is withdrawn and avoids eye contact. Which nursing intervention is most appropriate to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to join a support group for individuals with liver disease. Option 2. Discuss the client's feelings and explore coping strategies with him. Option 3. Provide educational materials about liver disease and its management. Option 4. Refer the client to a dietitian for nutritional counseling. The correct answer is B. Rationale. Correct answer B. Discussing the client's feelings and exploring coping strategies is the most appropriate intervention to address his psychosocial needs. This approach allows the client to express his emotions, which is crucial for mental health, especially when dealing with guilt and shame. It also helps the nurse to assess the client's coping mechanisms and provide support or suggest alternatives. This intervention aligns with the principles of therapeutic communication and psychosocial integrity. Distractor rationales. A. While joining a support group can be beneficial, it may not address the immediate emotional distress and is not the first step in this scenario. C. Providing educational materials is important for disease management, but does not directly address the client's emotional and psychosocial concerns. D. Nutritional counseling is important for managing liver disease, but does not address the client's current psychosocial distress. Clinical tip: when addressing psychosocial needs, prioritize interventions that facilitate open communication and emotional expression. This helps build trust and supports the client's mental health. A 45-year-old client with a recent rotator cuff tear is being discharged from the hospital. Which of the following instructions should the nurse prioritize to ensure proper healing and prevent complications? Here are the options. Option 1. A. Perform active range of motion exercises daily to maintain joint mobility. Option 2. B. Apply ice packs to the affected shoulder for 20 minutes every hour. Option 3. C. Use a sling to immobilize the shoulder and avoid lifting heavy objects. Option 4. D. Take over-the-counter pain medication only when the pain becomes severe. The correct answer is C. Rationale. Correct answer, C. Using a sling to immobilize the shoulder is crucial in the initial healing phase of a rotator cuff tear. Immobilization helps prevent further injury and allows the torn tendons to heal properly. Avoiding heavy lifting is essential to reduce strain on the shoulder, which could exacerbate the injury. This approach aligns with the principles of basic care and risk reduction by minimizing the potential for complications. Distractor rationales. A. Active range of motion exercises are contraindicated in the early stages of a rotator cuff tear as they can worsen the injury. B. While ice can help reduce swelling, applying it every hour is excessive and could lead to skin damage. D. Pain management should be proactive rather than reactive. Waiting for severe pain can hinder recovery and reduce compliance with rehabilitation. Clinical tip. In the early stages of a rotator cuff tear, prioritize immobilization and rest to facilitate healing. Gradual reintroduction of movement should be guided by a healthcare professional. While reviewing home care notes, a community nurse visits an elderly client who has recently lost a spouse. The client reports feelings of profound sadness and isolation and states, "I don't know how to go on without my partner." Which nursing intervention is most appropriate? Here are the options. Option 1. A. Encourage participation in a grief support group. Option 2. B. Suggest the client adopt a pet for companionship. Option 3. C. Provide information about local senior activities. Option 4. D. Recommend avoiding social interactions until feeling better. Option 5. E. Encourage reminiscing about positive memories with the spouse. Rationale. Correct answers. A, C, E. A. Joining a grief support group can provide emotional support and connect the client with others who understand their experience. C. Local senior activities can help reduce feelings of isolation and promote social interaction. E. Reminiscing about positive memories can be a therapeutic way to process grief and honor the spouse's memory. Distractor rationales. B. While pets can provide companionship, adopting a pet is a significant responsibility and may not be suitable given the client's emotional state. D. Avoiding social interactions can increase feelings of isolation and depression, so this is not a recommended intervention. Clinical tip. Encouraging social connections and activities can help alleviate feelings of grief and isolation in recently bereaved clients. Memory aid. Grief can be eased by great support, groups, reminiscing, engaging activities, and time. A 35-year-old client with Graves' disease has been experiencing increased anxiety and irritability. The client reports difficulty sleeping and feeling overwhelmed by daily tasks. Which nursing intervention should the nurse prioritize to address the client's mental health needs? Here are the options. Option 1. Encourage the client to join a support group for individuals with thyroid disorders. Option 2. Teach the client relaxation techniques to manage anxiety. Option 3. Refer the client to a psychiatrist for medication evaluation. Option 4. Advise the client to increase physical activity to reduce stress. The correct answer is B. Rationale, correct answer B. Teaching the client relaxation techniques is a direct intervention that can help manage anxiety associated with Graves' disease. Relaxation techniques, such as deep breathing or progressive muscle relaxation, can reduce sympathetic nervous system activity, which is often heightened in hyperthyroid states. This approach empowers the client with tools to self-manage anxiety symptoms, improving overall mental health and quality of life. While other options may be beneficial, they do not provide immediate relief or self-management strategies. Distractor rationales. A. While support groups can provide long-term benefits, they do not address immediate anxiety symptoms. C. Referral to a psychiatrist may be necessary, but it does not provide immediate coping strategies. D. Increasing physical activity can help with stress, but it may not be feasible if the client is already feeling overwhelmed. Clinical tip: teach clients with anxiety to practice relaxation techniques regularly, not just during periods of high stress, to build resilience and reduce baseline anxiety levels. A 7-year-old child with newly diagnosed diabetes insipidus is being seen for a follow-up visit. The child's parent expresses concern about their child's ability to participate in physical activities and maintain hydration. What is the most appropriate nursing advice to promote health and prevent complications for this child? Here are the options. Option 1. Restrict the child's fluid intake to prevent polyuria. Option 2. Encourage the child to consume fluids freely and monitor for signs of dehydration. Option 3. Advise the child to avoid participating in physical activities to prevent dehydration. Option 4. Limit the child's participation in physical activities to once a week. The correct answer is B. Rationale. Correct answer B. Encouraging the child to consume fluids freely and monitoring for signs of dehydration is crucial in managing diabetes insipidus and supporting normal growth and development. Maintaining adequate hydration is essential to prevent dehydration due to excessive urine output, and monitoring helps in recognizing any signs of fluid imbalance early. This advice aligns with promoting normal activity levels and preventing the complications associated with fluid loss. Ensuring the child stays well hydrated allows for participation in activities typical for their developmental stage. Regular monitoring and education on symptoms of dehydration are key components of effective self-care management. Distractor rationales. A. Restricting fluid intake would risk dehydration, especially in diabetes insipidus where ample fluid intake is necessary to compensate for lost fluids. C. Advising against physical activity is not appropriate as it can hinder the child's normal physical and social development. D. Limiting physical activity unnecessarily restricts normal growth and development activities without addressing the hydration management required for diabetes insipidus. Clinical tip: teach parents to encourage regular fluid intake and recognize early signs of dehydration, such as increased thirst and dry mucous membranes, to support a child's health with diabetes insipidus.
Okay, everyone, that was it for today's question bank. At the end of this tutor mode, you will get the score and all the rationale details here. Check out our test bank platform, Exam ASAP, our advanced adaptive testing platform featuring over 5,000 peer-reviewed questions designed to mirror the NCLEX experience. It includes detailed rationales, daily content updates, and a 24/7 AI tutor, resources recognized as industry-leading and proven to enhance your performance. Not only that, our question bank platform has next-generation NCLEX question types with case studies. We are adaptive and AI-powered platform that allows you to pass the NCLEX the first try. And don't forget to check out our ultimate NCLEX mastery notes at yournursingspace.com. While you're there, explore all our other free guides and study notes available to support your NCLEX journey. So check out our website for all those goodies. And I hope this lecture helped you feel a bit more confident whether you're studying for nursing school or gearing up for the NCLEX. Again, I'm Mark Johnson, your NCLEX instructor here at YNS, and I'll see you in the next lecture.